can you reiterate how you deal with patients who are on opiates already in oncology using naltrexone?
So this could be a very long answer, but I'll do the short version. What we have traditionally done, if the patient is already on opiates, it's much more dicey adding in naltrexone. If they're on naltrexone and then they add the opiates, sometimes that's much less of an issue. But what we always were able to do with patients who were on, in a lot of your stage 4 patients who may be on opiates, would be to start at 0.5 milligram or less and see what the tolerance is, and then titrate them very slowly. And with them, it's much more of a real side effect of having breakthrough pain. So we tell them that we're not only going to go slow, but we're going to have very close communication. And if they reach, just for the sake of a number to throw out there, 1.5, or maybe we're doing even smaller steps, milligrams, and they're fine. And then their first dose of 2, they have some breakthrough pain, we just go back down, just as most of us have said with, adjusting dosing for other reasons. This has always worked clinically for us, but we do have a separate consent that we have the patient sign about breakthrough pain because they need to know. The only time I've seen this not work was in a case where I was collaborating with the hospital, and the hospital pharmacist and the oncologist, neither of whom had ever used naltrexone, said basically, oh, that tapering thing is BS, and they put the patient right on 4.5 milligrams. She was in the emergency room with extreme breakthrough pain that night, and it took them a day to get the pain under control. And it was simply because they wouldn't listen to someone who actually did prescribe naltrexone.
We've had many robust discussions within the pharmacy world about this. So we start patients, again, titrating them up very slowly. We've always suggested 1 milligram is usually where we start to see that loss. So approach that 1 milligram slowly, and then again, follow the patient. But again, smaller steps, slowly, and then there is literature, and I don't know if I want to get into this, we'll talk probably more on Sunday. There's now literature out there showing that the opioid receptor and the use of opioids in cancers can actually accelerate some of the metastatic growth.
Definitely.
So using naltrexone, even in microgram doses or in these very low doses, can be beneficial and retard some of that accelerated growth. So